Good evening, President of this committee and members of the board of this committee. My name is Jreyes. I'm a registered nurse that represents a community in Indiantown, Florida. And I'm here to talk to you about the problems that the people who has mental health problems has facing for all these years. As you know, mental health is one of those disciplines that the insurance company doesn't want to deal with. And maybe this is because the patients with mental health problems are chronic patients and they need 1, 2, 3, 4 inpatient treatments in hospitals, and the insurance doesn't want to pay for that. But because of existence of foundations like NAMI, that they have been trying to fight for the right of these people to receive what they deserve as a prescriptions, services in the mental health field, everything has been changing. In January 2014, was created the Affordable Care Act, which was addressed that the people who has mental health problems has the right and has to be in the marketplace plans in order to receive insurance. And according to Cowell and Prakash, the marketplace plans did work. The amount of people who was insurance through them increases in almost double. But what is the problem? Like Medicaid has been, as Medicaid, there are other laws that has been helping to create a better coverage for people who has mental health. One of these laws was the Mental Health Parity and Addiction Equity Act, which was created in order to make insurance to cover patients the same way for people who has any kind of disease compared with people who has mental health. So the services has to be the same, regardless what is the cause of the service. But the problem is that the insurance companies have been trying to avoid, and they have been trying to change and not follow these rules, these laws. So, for example, there was a case which Mrs. D.D. Tillett has his son in one psychiatric hospital for recovery. The doctor, the psychiatrist, recommends that he has to be for a long period of time to really engage and get benefit from the treatment. But the insurance denied these services. 1 month after the patient was discharged, he died for overdose, and he was 21 years old. So Ms. Tillett went to the court, present her case, and she wins. The judge say, okay, what the company did was wrong. And the company was charged with breaching fiduciary duty and denying benefits. But legally, the judge didn't do anything against the company. They just say that they were going to change the policies, and that's it. So as happened with this case, also happened in California. The company calls Kaiser Permanent in 2013. They were accused, they were sued, they were found guilty, and they pay as the max $4 million. That for them is nothing comparing with the billions of dollars that they are making every year. In another case in New York, the Attorney General from New York received a suit against the Bacon Health Option Insurance. And the judge at the end didn't do anything, and he dropped the case. So as we can see, insurance company doesn't follow what the law says. And as Natasha Pierre, Vice President of NAMI in Hillsborough, states, the insurance companies are really putting a lot of pressure on hospitals and treatment providers. And they tell them, listen, we are not going to pay for the services. If you want to give the services, you have to find people who can pay for that. And people cannot pay for this service because it's expensive. So what is happening here in Florida? In Florida, we have some regulators, but this regulator doesn't put any pressure on the insurance companies. So the insurance doesn't provide service, doesn't give any plans that includes the benefit of having health coverage. So because this happened, the insurance doesn't give us the opportunity to get insurance. So what is the only thing that we can do? And this is why I'm here. I'm here to ask you to enforce the law. I'm here to ask you to create an office who can oversee all these problems and who can really follow up what is going on with the insurance and how they can avoid to make plans that includes the mental health. And this is very important because in our community, not many people have insurance for mental health services. So please take this in consideration and try to make laws that really enforce the insurance to do what they have to do. Thank you for listening to me. Have a good night.